Jerry was a 42-year-old Aboriginal male who was admitted to hospital in northern BC with upper GI pain, fever, and diaphoresis. He was married with 2 young children and lived on the reserve. Jerry's medical history included hepatitis C related to previous substance abuse, but otherwise was healthy. An abdominal ultrasound done on Jerry's liver revealed an abscess. He was then admitted for ongoing antibiotic therapy. Despite trials of several different antibiotics, Jerry's response was limited. It was determined by his doctor that he would need long-term inpatient IV therapy. A PICC line was established and daily community passes were approved. The nurses caring for Jerry openly disapproved of the order for him to have unsupervised access to the community with the PICC line in situ. They believed that he would use his PICC line to use illegal drugs. Jerry's doctors disagreed and stood by their orders. The nurses then manipulated Jerry's antibiotic schedule to limit his time out of the hospital. Each time he returned to the hospital, he was screened for possible drug abuse, and the results consistently showed no signs of impairment. As time went on, Jerry established relationships with several members of the nursing team. He had shared that he had turned his life around with support of his family and First Nations community. He had received treatment for his hepatitis and was no longer Hep C positive. The news was shared with other health team members, changing their attitude toward Jerry and his family. After over a month in hospital, Jerry was able to be discharged home to his family. Unfortunately, several weeks later, Jerry was admitted to the hospital again with a reoccurrence of his symptoms. A liver biopsy revealed that he had a cancerous abscess and he was given only a few weeks to live. A nurse was present with Jerry when he was given the news and stayed with him until his family members arrived. Staff members on the unit were devastated as Jerry had become so close to so many of them. As news spread in the community, the number of visitors increased daily. Some nurses complained that there was not enough room as there was too many visitors in the way, while others recognized the importance of gathering support for Jerry and did the best they could to welcome family and make everyone comfortable. A private room was procured for Jerry, and accommodations were made to allow for a drumming ceremony at the time of his death. This experience had a tremendous impact on the staff, as they had come to know Jerry as a warm and loving family man who was a respected member and leader in his community.